Sick of the week! Sick of the week! Sick of the week! Normally, I like to keep Sick of the Week light and fun, but we did create this segment with occasions like this in mind. And I want to use this week's SOW to talk about the Mpox outbreak that's coming out of Central Africa in order to give everybody a better sense of what's happening so that you can guide your own risk assessment. Okay, so to begin with, what is Mpox? We talked about it a little bit before in a different episode, but Mpox is a part of the orthopox virus family, which also includes smallpox, which we have talked about in the vaccine episode. It's a virus that's been endemic to several African countries for years, and it's important to know that there are basically two main types or clades of Mpox that we talk about. There's clade 1 and clade 2, and each of those types has a subtype that's clade 1A, clade 1B, clade 2A, clade 2B. Clade 1 has been the most commonly circulating type in Africa, particularly in the Democratic Republic of the Congo, or DRC. It historically primarily affects children. Despite formerly being called monkeypox, it's believed that the virus originates from wild rodents, and kids often get it when they trap and handle these animals. They can then spread it to others through close contact. Children tend to play very closely together, and siblings in a family often sleep in the same bed, which can spread the virus through both close contact and soiled linens. It can also infect adults who hunt and butcher bushmeat, who can also then spread it to their close contacts. Historically, most of these cases of Mpox had been happening in the western region of the DRC. So why is a public health emergency of international concern, or a PHEIC, being declared now? Transmission of clade 1 has been much higher, with the majority of deaths happening in children, and now we're seeing a lot more person-to-person transmission happening in the eastern part of the country. This transmission between people has caused the virus to spread into neighboring countries that have never reported a case of Mpox before. And because there is sustained person-to-person transmission, which is a change in the way that we usually see clade 1 spread, this form of the virus is now being classified as clade 1B. Now, this is where it's going to get a little bit confusing, so follow along if you can. Clade 1, which includes this new clade 1B, which is responsible for spread in and around the DRC, is different from clade 2B. Clade 2B is the form of the virus that was responsible for the outbreak in the US and Europe that caused the public health emergency of international concern to be declared from 2022 to 2023. The number of daily cases during that outbreak were lowered through vaccination and behavior change enough that the PHEIC was ended in May of 2023. But it never fully went away. In the US in 2024, there have been about 1,500 cases so far. And I want to mention this because in light of the clade 1B outbreak, I've seen some recent reports of Mpox cases in the US, and those reports are not clarifying that those are clade 2B. So far, the US has not had any cases of clade 1 Mpox, though it has advised healthcare providers to include it in their screening of people who show symptoms and have recent travel to affected areas within the last 21 days. So far, the only cases of Mpox clade 1B that have occurred outside of Africa are one case in Sweden and one case in Thailand, though that is likely to increase. So what is the difference between these clades? Clade 1 is endemic to Central Africa, and clade 2 is endemic to West Africa. The uniqueness of subtype B for each clade seems to be its ability to more easily spread between people. And you may have heard that clade 1 tends to be more severe or have more fatalities than clade 2. I think it's really important to remember that deaths are easier to report than cases. If somebody gets super sick, they often come to hospitals, in which case the reporting of death is straightforward. Mild cases are less likely to be reported or can be missed, or cases in remote areas are also missed. This means that the proportion of cases that result in death can be reported as higher than it actually is if we're missing mild cases that are never reported. Cases are also likely being underreported because the eastern part of the DRC is currently experiencing a war that is displacing millions of people into camps both within the DRC and across borders, and this is contributing to spread from crowded conditions. So let's talk about transmission. Mpox is spread by skin-to-skin contact with Mpox rashes or scabs, bodily fluids like saliva, blood, and respiratory droplets, as well as by sexual contact. It can also be spread when people come into contact with soiled clothes or linens. Transmission with respiratory droplets requires sustained close contact. It is possible, but it's not the primary mode of transmission. Mpox can also be transmitted to fetuses during pregnancy. Now, there is a vaccine for Mpox that is the same vaccine that we use for smallpox, and it was used extensively during the Clade 2b outbreak to help get it under control. It's also expected to work against Clade 1. Now, you might be wondering if you need to get vaccinated. The majority of cases that are happening in the eastern regions of the DRC and neighboring countries are happening amongst children, sex workers and their clients, and men who have sex with men. Clade 2b, which is the one that still exists in the United States, those cases are also predominantly happening amongst men who have sex with men. Unfortunately, early results from a clinical trial of the antiviral TPOXX, that was the hopeful treatment for Mpox, have found it to be no better than a placebo. So there's currently no treatment, but an interesting aspect to the study was that people in the study had a lower mortality rate than the rest of the cases in the country, highlighting the importance of supportive care when people get sick. The point of a public health emergency of international concern is to allow for the WHO to make temporary recommendations on how to address an issue. It's also to raise awareness so that there's international buy-in and cooperation with the response. What we really need is to get vaccines to the people in the most affected countries and populations. We need to try to control the outbreak where it is and prevent it from spreading further.
Laurel, it sounds like there are vulnerable groups and vulnerable populations that are being affected by this current Mpox outbreak, as well as the outbreak that we saw a few years ago. I'm curious how we can be sensitive to those groups who may feel stigmatized from the messaging around this outbreak.
Yeah, absolutely. I mean, I think it's good to be concerned about the messaging and the way you approach these groups that are being affected. But the thing is, what we want to do and what we need to prioritize is getting the groups who are affected, who are at most at risk, the help as quickly as possible. And so sometimes that just requires identifying them so that we can work within the communities with community leaders to get people the treatment and the vaccines and the support that they need to find these cases. And, Mpox is not it's not a signifier of morality. Viruses really don't care who you are or your background. For example, there was an Mpox outbreak in the United States in 2003 that happened amongst prairie dog enthusiasts because infected prairie dogs were brought into the United States and it spread between people, between states. And if that was happening right now, we would be telling people, if you are a prairie dog enthusiast or someone who goes to prairie dog conventions, then you too should talk to your doctor about getting vaccinated. So I think it's just really important to remind people that this is spreading through close contact between people, and it just so happens it got seeded in these populations, and so these are the populations we need to focus on and care for right now. So I guess for this week's Sick of the Week, we're going to give it to prairie dogs, who are the original patient zero for Mpox.